So if you're going to be the recipient of the kidney, there are a number of tests that will be done, right? So number one, we'll need to know, can you handle the surgery? What is your performance status? How are your kidney? How is your heart? For example, how are your vessels? Where are we going to put this kidney? Then both of you will do something called cross-matching. So both for blood, for tissue, we'll do something called HLA matching. There are other tests that will be done on the donor. We need to check, how are your vessels looking like? Do you have, for example, kidney stones in your kidneys? Do you have a tumor? How is the urinary system, both for especially for the recipient, so that we don't give you a kidney and then you get urine blockage, and that can impact on the graft. The graft is now the kidney that we are going to give you. And once the committee sits and gives a go ahead, then usually you will be booked. Okay, a specific date is going to be assembled. All right, and then on the day of theater, usually there will be two theaters. Okay, one for harvesting the graft or for harvesting your kidney. Usually the two theaters are interconnected by a door. So they are this room and another room here. And the two surgeries will start concurrently. So there is one team that will be harvesting the graft. So that is where us as urologists come in. Okay. So our work usually is very simple. The role of the urologist is usually actually the smallest. The nephrologist will deal with you before pre-transplant, and after transplant, you will continue with the nephrologist. The urologist usually comes in during the surgery. After that, you continue with the nephrologist. So the work of the urologist inakuwa kidogo. It's important, but inakuwa kidogo. So in one room, you'll have the donor and the urologist harvesting your kidney. In the next room, you will have the vascular surgeon and a urologist. The vascular surgeon, the work of the vascular surgeon is to connect. Usually we put it here, and it is to connect the vessels of the kidney to the vessels of your body. And then the urologist is going to implant the ureter from that kidney to your bladder. Okay? So that is called ureteral implantation. Now, once this kidney is removed, there's an intervening room in between where that kidney is going to be flushed with fluid that has saline, because we don't want any cellular activity happening there. So within 30 to 40 minutes, a period we called warm ischemia time, that kidney need to be transplanted, right? And once it is transplanted, you will continue on medication called immunosuppressants. The work of immunosuppressants is to make sure your body does not reject that kidney. And most of the time when you hear people that they went for transplant and their kidneys are not functioning, it's because they got something called rejection. And rejection can happen anytime, on table, after a few days, or after a long time, or even after 15 years. So that's why you need that medication, so that your body does not reject this new kidney. After that, the role of the surgeon, my role as a urologist there, actually will just be to follow you up and to come and remove a stent probably after 4 to 6 weeks. After that, you will be followed up by the nephrologist. So that's the transplant part. After that, it is followed up by the nephrologist. What are the issues that are usually encountered? Usually, commonly is on the recipient. You can get rejection, you can get infection on the site, you can get cancers because of immunosuppressants, and you can get recurrent infection again because you are on medication that is reducing your immunity. But over time, the immunosuppressants usually are reduced over time, but again, by the nephrologist. So, as I said, the work of the urologist is kidogo. It is the important part of transplanting, but the important part is the nephrologist before and after. And of course, your renal nurses. They are going to continue monitoring you after that. So if you are there and you are thinking about a kidney transplant, number one is that it is not for sale. You don't buy it. The donor and the recipient are usually rigorously selected, so it does not happen. And if someone for some reason tells you he can buy your kidney, just know it is not going to happen in a hospital that is accredited. You will probably not be having it done by doctors who are certified. So the risk, the legal risk, and even the risk of death is going to be very high. So let no one lie to you that you can sell a kidney in this country and anywhere else. in this world. It will be an underworld procedure. You might not even live there fully recovered, or you'll probably live there dead. You as a donor, not even the recipient. Okay? So I cannot overemphasize that point. Human organs are not for trade.